Dr. Tyagi to BW Healthcare and start with my first question. How has robotic surgery evolved over the past decades and what are some of the key advancements in this field?
So robotic has came long way since last 1 decade. It came into the India in the between 2005 and 2010, and I started using the robotic in 2012. Now robotic has multiple advantages, which basically translate into the better outcome with the patients, better outcome with the disease, and a good safety to the surgeon also. So advancement means the surgeries which are being done with a longer incision are now being done with a mini hole incisions. The surgery which are never being done initially because of their more invasive in the nature, they are now being done very routinely. Surgeries which are thought to be complex, for which patient need to be in the hospital for 7-10 days, now can be discharged in 2-3 days. So ultimately translating into the advancement of a surgery technique which is translating to the benefit of the patient and as well as of the surgeon.
What are the primary benefits of robotic surgery compared to the traditional one?
So in a traditional surgeries, we normally give an incision, we put our hand and then do the surgeries. Then came the laparoscopic surgery and we put an instrument, but those instrument has a limitation of the movement. Now the robot provide us more like a PlayStation or an Xbox, where you just move our cursors and the same thing can be followed by the robotic arms. So by virtue of that, the incision are lesser, and the lesser the incision, the blood loss is less, the stay in the hospital is less, patient recovery is better, and when the patient is go back to their work, the human resources will increase. So ultimately it translating into a better recovery and a better outcome.
How are emerging technologies like telemedicine and AI transforming patient care and healthcare delivery?
So I would say that in the surgical field, the telemedicine and AI does not right now have a significant role because those are dynamic things. The telemedicine and AI does have a role in a physician things, where you just want to prescribe a medicine by looking the patient. Now we have certain gadgets by virtue of which a person, a physician sitting in Delhi can take the ECG of a person sitting in a village or a blood pressure of a person sitting in a village and then prescribe in a medicine. Now I'm a surgeon. In the surgeon, those telemedicine does not matters a lot because I cannot operate sitting here and doing the surgery in village. The same way, the artificial intelligence is still now more static, that we can use to predict a thing, but we cannot to predict a surgery. So in a surgical field, the role of telemedicine and AI need to be much more improved.
Thank you so much for your time, sir.
Thank you
So much.